Welcome to Get Healthy with Dr. Cooper. I'm Dr. Dona Cooper-Dockery, board-certified internal medicine physician, more than 30 years of practice, and I am grateful you're here with me today. We have covered a lot of ground in this series: insulin resistance, blood sugar, and the A1C, the metabolic truth behind weight. Each episode has been building toward a fuller picture of how diabetes develops and what we can do about it. Today, I want to complete that picture, and I want to do it honestly. There is a statement I make to my patients. Often I say it because I mean it and because the evidence is unambiguous. Diabetes, left unaddressed, is not just a blood sugar problem. It is a whole body condition. And when it goes uncontrolled over time, it does not stay in one place. It reaches. It moves through the body, through the blood vessel, through the nerves, damaging systems and organs that you may not associate with blood sugar at all. Today, I am going to walk you through those complications honestly and clearly, not to frighten you, but to inform you. Because in my 30 plus years of internal medicine, the patients who understand what is at stake are the ones who act. And acting early is everything. Nothing here is random. Everything follows a clear biological path. When blood sugar stays elevated over time, it does something very specific to your blood vessels. It damages them, particularly the small blood vessels, the microvasculature that supply blood to your kidneys, your eyes, your nerves, and the larger vessels, the ones carrying blood throughout your entire body, become inflamed, stiff, and prone to dangerous blockage. Think of it this way: glucose in the right amounts is your body's fuel, but chronically elevated glucose circulating through your blood vessels day after day, year after year, is like running something abrasive through a delicate tube. Over time, the lining wears down, the tube becomes damaged, and the organs that depend on that blood supply begin to suffer. That is the foundation of every complication I'm about to describe to you. One mechanism, many consequences. The kidneys are among the first organs to show the damage. And I want you to understand what is at stake here, because kidney disease is silent until it is serious. Your kidneys are one of the most extraordinary organs in your body, day and night, without pause. They are filtering your blood, removing waste products, balancing fluids, regulating blood pressure, and producing hormones that support bone health and red blood cell production. They do this through millions of tiny, exquisitely delicate filters called nephrons. When blood sugar is chronically elevated, the small blood vessels feeding those nephrons begin to thicken, to scar, to lose their ability to filter effectively. At first, the kidneys compensate. They work harder. They push through, but over months and years, the damage accumulates, the filtration capacity declines, and eventually, kidney function falls to a point where the body can no longer manage on its own. This is diabetic nephropathy, and it is one of the leading causes of kidney failure in the United States. When kidney function drops far enough, the conversation becomes dialysis, 3 times a week, hours at a time, connected to a machine doing the work your kidneys can no longer do. I have had those conversations, and I want to tell you that is a conversation I never want to have with you, because in so many cases, it is preventable. With early detection, with blood sugar control, with the right food, with a physician who is looking at the full picture. The kidneys give you very few warnings: a little protein in the urine, a slight rise in creatinine, easy to miss, easy to dismiss. This is why annual kidney function labs are not optional for anyone with diabetes or prediabetes. They are essential. Now let's talk about your eyes. The retina at the back of your eye is one of the most metabolically active tissues in the body. It is fed by a dense, intricate network of tiny blood vessels. And those vessels, because of their size and sensitivity, are among the first to show the effects of elevated blood sugar. Diabetic retinopathy begins when those vessels start to leak, swell, or grow abnormally in response to the damage. In the early stages, there are often no symptoms at all. Vision can look completely normal. You may not notice a single thing, and yet, inside, the damage is accumulating. As the disease progresses, blurred vision begins, floaters, dark spots, and in advanced stages, severe and permanent vision loss. That is the phrase I want you to sit with: preventable. With proper blood sugar management, with regular dilated eye exams, with catching it early, most diabetic vision loss does not have to happen. But it requires knowing to look. It requires showing up for the appointments. It requires treating this disease like the serious whole body condition it is. Diabetic neuropathy is the complication that I find most people are least prepared for. When blood sugar stays elevated over time, the small blood vessels that feed your nerves begin to deteriorate. The nerves become starved of oxygen and nutrients, and they begin to malfunction. This typically starts in the feet and lower legs, a tingling, a burning, sometimes described as electric shocks, sometimes as walking on sand. These are the early signals, but as neuropathy progresses, sensation can be lost entirely, and that is where the real danger lies. When you can no longer feel your feet, injuries go undetected. A small cut, a blister, a pressure point, these heal slowly in people with diabetes because circulation is already impaired and immune response is compromised. A small wound becomes infected. An infection becomes serious. In the most severe cases, amputation becomes the conversation. I share this not to shock you, but because I have seen it. And I have also seen what happens when patients catch neuropathy early, when they take the tingling seriously, when they address their blood sugar aggressively at that stage. The progression can be slowed significantly. Everything I just described, the kidney damage, the vision loss, the neuropathy, it is all driven by the same thing: chronically elevated blood sugar. And one of the most powerful interventions for blood sugar is what you eat.